Repetitive Questions by Dr. Ian James and Keris James. Dealing with repetitive questions requires patience and an understanding of how to break out of the loop of repetition. General strategies include remaining calm, acknowledging and answering the questions, and redirecting the individual to a different activity or topic. Visual aids like notes or photos can help. It's also helpful to address the underlying emotion or need that is driving the questions. In this animation, we will first give you the standard guidance on dealing with repetitive questioning, and then we will give you 2 further pointers that will help supercharge your technique. Number 1. Stay calm. Remain calm and avoid getting frustrated because your reaction could escalate the situation. Remember that the behaviour is often a symptom of short-term memory problems and not a strategy used by the person to deliberately wind you up. Number 2. Acknowledge and redirect. Acknowledge the question even if you've answered it before, but don't dwell on the fact that it's a repeat. Try to shift their focus to something else, perhaps an enjoyable activity, a familiar object, or a happy memory. You can also try asking them a question about the topic or redirect them to a visual aid. Number 3. Address underlying needs or feelings. Repetitive questions can sometimes stem from anxiety, fear, or a need for reassurance. Try to identify the emotion behind the question and address it directly. For example, if they are worried about being late for a future event, provide reassurance. Consider using visual reminders like calendars or clocks to help with orientation and reduce anxiety. Although these strategies are useful, they can be further enhanced by 2 additional features, known as the favourite tracks technique and the loop completion technique. Both of these strategies are based on having a deeper understanding of why the repetition is occurring. The favourite track technique is simply a guide for using redirection and distraction. The topic that's being repeated by the person is frequently related to a worry or an emotional concern. For example, wanting to know the time of an appointment, asking to go home to look after a sick relative, or requesting the car to collect children from school. These topics are often so concerning that a normal redirection activity with little emotional strength, such as going for a walk, is unlikely to outcompete the worrisome topic. Hence, it is suggested that any redirection strategy being employed should be of a high level of emotional importance for the individual, meaning the person must be highly invested and knowledgeable about the redirecting topic. It also must be a topic that they enjoy talking about. A good way to imagine it is as a scratched record on a turntable. Initially, the person living with dementia is stuck in a groove of repetitive negative worrying thoughts. Thus, the role of the carer is to lift the needle and place it on an alternative track, a track that is more positive. However, in order to prevent the needle returning to the negative groove, the new choice needs to be a favourite for the person. The person must be able to become fully immersed in the new track and join in with the activity in a joyful and confident way. It's worth noting that to use this technique, the carer needs to know information about the person's past, their hobbies, and details about their family, etc. The loop completion technique is based on a phenomenon known as the Zeigarnik effect. This states that people will remember unfinished or interrupted tasks better than completed tasks. This tendency is due to the cognitive tension created by an incomplete task, which keeps it active in our memory. Examples of this are when restaurant staff are able to remember large orders of food and drinks right up to the point that they are delivered. However, once completed, the details of the order are forgotten completely. Sometimes we are aware of the Zeigarnik effect when we get a feeling of knowing. In these circumstances, we are aware that we intended to do something but can't quite remember what it was, such as turning off the iron or adding water to the pan. In relation to repetitive questions, we need to ensure that the person feels their question has been answered fully. This closes the loop, thus preventing the Zeigarnik effect from taking place. Too often, due to frustration, carers fail to answer repetitive questions fully, or simply ignore them altogether. In such circumstances, the loop is never closed, and the topic is likely to pop back into consciousness. So, the advice is to fully answer the question, ensuring that the person appears satisfied with the response. It is then important for the carer to employ the favourite track technique, fast enough that the question's response has not been forgotten. The techniques mentioned are unlikely to work all the time. However, they can be extremely effective. They make use of what we know about repetitive questioning and provide a structured response that can be taught to other carers. Please note, in circumstances where the person living with dementia and/or the carer are getting upset and distressed, it is important to seek extra support from local experts and professionals. Thank you for watching.